Okay, hello again. So here we are moving into chapter 7. We're going to be talking about person-centered and humanistic psychology. So the main two are going to be Maslow's hierarchy of needs as well as Carl Rogers' person-centered therapy. So, what is humanistic psychology? It becomes popular in the 1950s as an alternative to some of the more deterministic approaches, such as psychoanalytic and behavior therapy. We haven't talked much about behavior, but that will be, I think that's the next chapter that we're doing where we'll talk about this. But the main dominating therapies at this time were psychoanalytic and behaviorist. So Freud, behavior is determined by unconscious forces, and Skinner, behavior is shaped by the environment and conditioning. And so these were the two major approaches if you were seeking help. And so some of the people, as we saw with like existential, because existential can be part of that insight oriented, but it also works into humanistic because it's interested in human growth as well. So the humanistic psychology, they de-emphasize pathology. So by pathology, I mean psychological, people who are psychologically abnormal. So it de-emphasizes that and tends to be more encouraging, seeing strength. So you can see a lot of Adlerian principles in humanistic psychology. It also believes in the inherent goodness of people. And it believes that people are motivated by a desire to grow and reach their potential. So this starts getting developed in the 50s. So when we're looking at the different frameworks, if we look at Freud, he's saying the main thing is the pleasure principle. People are motivated by pleasure. Adler says they're motivated by desire to overcome their inferiority. The existential psychologists say that it's about the need to create meaning, and the humanistic say that it's the need for personal growth. So these are the different frameworks that are out there to help you work with clients and to understand people. So, one of the figures is Abraham Maslow. He was born in Brooklyn, New York. He got his PhD in psychology. His background was in behaviorism because you had your choice. You could do psychoanalytic if you were studying psychology, or you could do behaviorism, and he chose to study behaviorism. He was also not a clinical person. He was focused on research instead of clinical practice. And one of the things that he noticed when he was doing research is that there was not a lot of research on the positive side of psychology. Psychology was focused on what is wrong with humanity. Focused on diagnosis. It's focused on those types of things. And he's just like, hey, but we don't have a lot of research saying like how do people live a good life? Like how do we help them? Sure, we can get someone out of the misery of depression, but then what? And so he started asking these questions and was interested in that. And the thing that's kind of interesting about this idea doesn't get picked up again until the 1990s when Martin Seligman starts researching for positive psychology. So most of the research that we know in psychology is about depression, anxiety, schizophrenia, bipolar. It's about what is wrong with humanity, and not about what are the tools to help people live a more meaningful life. So, um, so he gets his PhD in 1934. In 1935, he is mentored by Adler for about 18 months. He's also influenced by Alfred Adler, as well as behaviorism, but not necessarily Freud or psychoanalytic approaches. In After 1935, he becomes interested in some of the his mentors or people that he admired, and he wanted to start kind of researching and collecting patterns or data and trying to understand the commonalities of these people in his life that he saw as quote unquote lofty. He wanted to know what motivated them, what their common denominators and their value and their humor, even in their mystical experiences. So he starts looking at these ideas, and this could be the formation of like people he considered to be self-actualized, to be fulfilled. And so he wanted to know what were they doing, and is there a way that I can distill this down a little bit more? Also in 1935, he attended a lecture on Eastern philosophy on Taoism, which was talking about the idea of being and doing, right? We saw Rollo May talk about that, being influenced by that idea as well, saying that we needed to learn how to be rather than do, and doing is a byproduct of industrialization and all of that sort of stuff. So Abraham Maslow is also influenced by this idea. And then in 38, he spends 6 weeks with the Blackfoot tribe in Alberta, Canada, and inspired by their concepts of self-actualization. So while he's interested in these ideas, he doesn't necessarily have like an understanding of it. But this tribe in Alberta, Canada, actually has a philosophy built around this, and so he starts building off of these ideas. Um, in 1950s, jumping ahead, he founds humanistic psychology. And this idea of humanistic psychology fundamentally changed how psychologists understood human behavior. And then in the 1970, he died at home in California. So in his life, he published at least 6 books and had hundreds of articles or papers or essays. The thing that we know Maslow, the thing that he's most well known for is Maslow's hierarchy of needs. And so he criticized Freudian psychology for pathologizing normal human experiences and its pessimistic view of human nature. And so he created this idea of a triangle, a five-tier model to explain human motivation. And he basically said that basic needs must be met before one can pursue self-actualization. So if you don't have your physiological needs met, then you can't pursue self-actualization. He also coined the term peak experience and introduces this concept, which he says are in humanity those moments of intense joy, creativity, insight, awe that we may have in our lives as well. And a lot of these concepts influenced positive psychology. So why do human service professionals get trained in hierarchy of needs? This is one of the mental frameworks that you will use when you're working with your clients to understand where they are, and it will help you um, figure out where to target your what needs to be done next, right? So, for example, if you have a client that is struggling with like addiction and they are struggling with housing and they also have a trauma history, if they come to you and they're just like, I want a trauma therapist, if by going by Maslow's hierarchy of needs, you might say, well, let's work on getting you shelter first. Let's work on getting you in recovery. And while we get you some stability in your life, then we can start looking at your trauma, getting the some trauma work done as well. So rather than going for the trauma and not taking care of those other things. So these are some of the ways that like human service professionals can use the hierarchy of needs. So if we're just even trying to identify hierarchy of needs, a person who's applying for SNAP or heating assistance, which hierarchy of need is that? So if we look at the pyramid, we can see that if you're applying for SNAP, that means that you are struggling with food insecurity, and then heating assistance, you're probably struggling financially and having shelter. So those are going to be the physiological needs. Um, A person who is seeking career advancement, they probably have their physiological needs met, but they might be struggling with like esteem issues, achievement, and that's where they would be in the pyramid or the triangle. A person who is seeking divorce services, I'm sorry, a person who is seeking domestic violence services, they're going to probably be dealing with safety and security as the primary. But also you have to assess if they're going to need help with like shelter, um, as well. And then a person who's going through a breakup or a divorce, they're going to be struggling with love and belonging. And a person who's seeking more meaning in their life is going to be looking at self-actualization. So that's just a way to try to understand how we use the hierarchy of needs or how we assess where our clients are and what the interventions are that they need. So moving away from Maslow and moving into person-centered therapy, sometimes known as client-centered. That's what well, I think originally he called it non-directive, then client-centered. Sometimes it's known as Rogerian therapy because that's his last name, but person-centered is also it. So you might see in, textbooks and writings, you might see all of those versions. So this is Carl Rogers. He was born in Illinois. He originally attended seminary school, but decided to get a PhD in psychology because he felt that was the way that he could help the most people. And then in 1928 to 1940, he was a therapist at Rochester Center for Prevention and Cruelty to Children. So he worked there for 12 years. And I point this out because oftentimes, and if you go back and you look at in the other key figures, you'll see that when they develop their ideas, like Freud doesn't develop his ideas of psychoanalysis overnight. It's actually him practicing with clients for 7 to 10 years before he starts getting his coining the term psychoanalysis, coining his theories about the unconscious, coining his theories about the id, the ego, and the superego, and all of those types of things. And you'll see this play out time and time again, where it takes a while to get the basics of whatever it is that you're doing, whether it's case management or therapy down. And then it's usually after 7 to 10 years that you see people saying, like, what I know is not always working with all of my clients. What else is there? What else can I do? And that's usually when you start seeing that. So Carl Rogers shares this story when he was when he was working with a client um, that it didn't go very well. So he's been, working with clients for 10 to 12 years and it didn't go particularly well. The client stormed out, didn't like his psychoanalytic interpretation of like what was going on. And then when they met again, he just spoke with her and listened and didn't try to do anything, didn't try to, interpret what was happening, didn't try to do testing, didn't try to diagnose, just listen to the client and their perspective of what they thought the problem was. And he recognized that just by listening and asking a couple of key questions and reflecting back their emotional state to them, that seemed to help them way more than any of the psychoanalytic approaches. And so that kind of that got this idea like, maybe there is another way to help rather than doing what he had been trained to do. So he starts developing this idea and about in 1951 he publishes client-centered therapy, which is what we now call person-centered. So it took him a while to get to that point before he was able to take all of the information, right? When we talk about use of self, his personality, his beliefs, he was trained, he had seminary school, he was trained in psychology, and then he had his experiences with clients, and through his use of self, he was able to create this client-centered approach. Other things that other well-known publications, in 61 on Becoming a Person, in 1980 on Way of Being, and then you never know where your career is going to take you, because in 1987 he was nominated for a Nobel Peace Prize because he started working on in conflict management. So he was working with people in South Africa and Northern Ireland on the conflicts that were happening and trying to help resolve that. So you never know where your career is going to take you when you start working in this field. And then he passed away in 1987. In his career, he published 16, at least 16 books and over 200 articles, papers, or essays. He also has a large video. One of the things that he did that I think was really interesting is he used the technology tool of the time, which was a tape recorder. Well, they were these giant reel-to-reel things, but he started bringing that into his practice, where he would record the sessions with clients and he would, with their permission, and then he would play them back after his sessions. And he said that he learned so much. He learned in areas where, like, he miss something with his clients, or he said something that shut the client down, and it really taught him how to be a better therapist. So you may do something later on in your education called a process recording, usually when you're at an internship. And this is part of the reason why it's really good to have a recording there and to just see what it is that you're doing, where the clients respond to you, where they don't respond to you, where you may be misstepped. And so having those recordings every once in a while and checking on yourself and your progress, he said really, really helped him as well. Anyway, he was very into that technology. So there's a lot of recordings of Carl Rogers, either his therapy sessions that he did with various clients, or just even him sharing his lectures or talking with people. So there's a lot of that is on YouTube if you're interested, find or intrigued by person-centered therapy. So person-centered therapy gets developed in the 1940s and 50s by Carl Rogers. Um, and I think I told you in that previous slide that he found that after 12 years of practicing psychoanalysis, that he wasn't having a lot of success and he was discouraged, and that he noticed when he used a more genuine and non-directive approach, there was greater improvement with his clients. So this is a big deal when he calls something client-centered. So patient denotes the idea that the professional is the expert, but when he switched and used the term client, which was unheard of at that time, they were all patients. It was giving uh, he was making the client the expert, more collaborative. Like lawyers have clients, like who else has clients, right? So he was giving more, they were hiring him for a service that he needed to provide, and it was about empowerment. And then eventually that turned into person centered, but it was originally called client centered. So he was into empowering his clients. So, what is person-centered therapy? The core of person-centered therapy is the therapeutic relationship. So, we hear Adler talking about the importance of the therapeutic relationship. Remember, he's like, we're not going to sit on a couch, we're going to sit in chairs. And Rogers really explored this and really honed this. And this is probably one of the first. Things that you'll be taught. If you ever heard someone like, you're developing rapport with your clients, well, how do you do that? It's the person-centered approach. Um, some of the earlier psychoanalysts weren't really concerned with developing rapport. They were doing that blank screen and being neutral and not showing any personality. But person-centered was just like, no, be an authentic, genuine self. Be a real person. It's important for your the clients that you're working with know that you care, not holding that information back to them. So he is the core of this is that therapeutic relationship. It also focuses on the present. It focuses on present experiences rather than delving too deeply into past issues. And it's oriented for self-exploration and growth. So this might not be the best therapy if like someone's coming in like in some type of like crisis in the moment, or it might not be the best therapy if someone has been diagnosed with something like antisocial personality or something along those lines. So it's important to know when to use person-centered and when to not use it. But if somebody is looking for self-exploration and growth, person-centered approach is a good approach to use. Um, in terms of theories and techniques, the main theory is what he calls the three attitudes that foster change and growth in his clients. So the first one is congruence, and it's that means authenticity. The therapist is genuine and transparent in their reactions. And he says that without this, without being genuine and transparent, authentic with your client, showing up and use of self, who you are, your personality, those will not allow, if you don't show up as yourself, you're not going to have unconditional positive regard or accurate empathy. So the other thing that he mentions is unconditional positive regard, and that is supporting your client without judgment. So it's not I'll accept you when you do X, Y, and Z. It's like I'll accept you as you are. In Carl Rogers says that change is more likely to happen if unconditional positive regard is felt by the client, if they have that safe space to explore the deeper parts of themselves, the unpleasant parts of themselves. If they don't feel like they're accepted, they may not have the courage to really explore some of those darker sides of personality. So that unconditional positive regard is necessary to explore the pleasant aspects of ourself, but also some of the darker aspects of ourself. And then in terms of accurate empathy, uh, this is what he says is where the therapist actively strives to deeply understand the client's emotions and subjective experiences. In accurate empathy, we use reflective listening. So if you remember back to chapter 2, when we were talking about the tools of a helping professional, we talked about active listening. He doesn't call it active listening, he calls it reflective listening, but essentially they are very similar. And reflective listening has some of this, paraphrasing, but it's really paying attention to the emotional um, attuning to the emotions of the person that you're working with. So techniques establish a strong therapeutic relationship, being non-directive, so trusting the client to direct therapy, not giving advice, believing in the client's ability to solve their own problems, even when they are asking for you to solve their problems. Thinking about that in terms of that existential piece of choice, freedom and responsibility and accepting responsibility to make choices. So there's that non-directive. Carl Rogers calls it non-directive rather than going into that freedom, responsibility, and choice bit, but it's very, very similar. And then reflective listening, and that really is paying attention to the emotional content. So when you're paraphrasing, you are showing emotional understanding. Sounds like you're frustrated with this situation because you're clarifying emotion. So if you're not sure how the client is feeling, you could say, "It seems like you're feeling overwhelmed. Is that correct?" And it's okay if you guess wrong. That's one of the things that I don't think that we say enough, which is, we're human, so we may say like, "Oh, are you sad?" And then we're just like, "I'm not sad about that." That's okay because that's actually helping the client because they can look at it and say, "Well, no, that's not the emotion that I'm feeling. I'm actually feeling this other thing," and then that can help them start to regulate their emotions, right? Remembering back to chapter 2, one of the things that is an essential skill is for us to understand our emotions and understand the richness of our clients' emotions as well. So clarifying emotions. And then validating can also help a client feel understood. And so one of the things that they talk about with validation is that it's not necessarily the same thing as acceptance. So you can validate that someone's feels angry without accepting or excusing the behavior. I can understand why you feel angry about that. So, just think about, somebody in your life who doesn't um, pay their bills or pay their parking tickets, and then it causes all this distress that's in their life, and you're just kind of like, oh, well, if only you did this, then this wouldn't happen. So you can still validate their emotional experience that they're having in the moment. Their frustration, their anger, without necessarily having to like make excuses for the thing that they did. So that's just a differentiation that's there. Some of the limitations and criticisms of person-centered therapy are that so Rogers was a huge believer in research. So he was always conducting research, but the research that he did was often met with criticism. The sample size wasn't good enough. It wasn't objective enough. They didn't do the gold standard and in terms of like setting up like research things. But he believed in research and was always tr researching his theories. Um, the other thing he gets criticized for is lack of clear techniques. However, as we mentioned in chapter 2, I think it was, could have been chapter 1, techniques only account for about 15% of client outcomes. Most of what matters is that the therapist is skilled but is able to show warmth and positive regard to their clients. That is what helps most people and what most people remember about their therapists or case managers. Um, so some of the criticisms of Rogers' research, small sample size, not using a control group, not accounting for placebo effect, reliance on um, self-reports, not selecting the best statistical formula to analyze the data. Another criticism is that new therapists, if they're only trained in person-centered therapy, may not have enough skills to balance being supportive and challenging. A therapist, while they may use this approach, will also find times where they have to challenge gently a client's thinking. And if you don't have other frameworks to understand what's really going on with the client, it can be challenging to do that. So you could end up in that. If you think about what AI, ChatGPT, I think it was like ChatGPT Model 4 was criticized for being too sycophantic, just too like accepting of things. So you don't want to do that. That's like an overcorrection. And then for some people, they might find a person-centered approach to be too passive or non-directive. It might not work, for some cultures, they might want advice and guidance and structure. Um, and the main techniques can be empathy and active listening, and sometimes, while we want this, this therapy was intended, it's humanistic for self-growth, it can also hinder personal growth if they are just always being if there's too much empathy and not enough push for growth as well. So the takeaways when it comes to humanistic psychology is that the belief is that people are inherently driven to grow and reach their potential. So that may be true for you. Do you think that's true for all people, some people, most people? So you have to think about that. Do you agree with that? Maslow explained people's motivation through hierarchy of needs. Um, the highest one being self-actualization. Carl Rogers believed growth occurs in environments with empathy, acceptance, and genuineness. And together, these perspectives highlight the importance of supportive relationships and meeting basic needs to help individuals thrive. When people feel safe, valued, and understood, they are more likely to become their best selves. And as I mentioned, there are many videos on YouTube of Carl Rogers doing therapy with real clients or discussing his theories and approaches. So this ends our section on humanistic therapies. So existential and person-centered were the two big ones for humanistic. Next, we're going to be moving into behavior therapy and cognitive behavioral therapy. We'll be exploring those.